Hi, my name is Caitlin and I am in the UT Tyler nursing program. Today I will be presenting how important diet is related to type 2 diabetes in those over the age of 50. Before today, I asked you guys about your willingness to change about the dietary effects of high glucose and type 2 diabetes. You all three said that you did not know the difference between high glucose and low glucose snacks, but would be willing to learn after and during my presentation. This makes you in the contemplation to change category. Many people find it difficult to maintain appropriate glycemic control. However, with this presentation, I hope you can take away ways to positively influence sustaining good nutrition with diabetes. In general, about 1 in 10 people in America currently have diabetes, and about 422 million people in the world have diabetes. I am going to hand you guys a questionnaire to fill out that you will give back to me at the end of this presentation. There we go.
Thank you.
And this has a questionnaire and a little handout that actually shows the difference between high and low glucose foods. Before we get started, I would like to ask y'all just a couple of questions. Can you tell me just in a few words what health means to you?
That means my overall physical well-being, my ability to do my day-to-day and not have to worry about it.
Okay. And if y'all are all diagnosed with diabetes, which you are, I'm sure that your doctor talked to you about a proper diabetic diet. Do you know what your doctor said to you about what a diabetic diet means to you?
It means to watch your food at the glucose level of your food, get exercise, and just
not eat a lot of sugar.
Yeah, it's a good one. So in a normal body that does not have diabetes, when glucose is consumed, or like sugar is consumed, insulin is produced to attack that glucose and convert it to glycogen, which decreases your blood sugar. With diabetes, there has been too much glucose in the blood, and there is not enough insulin to convert that much glucose that is to be released from the bloodstream. Therefore, you create an insulin resistance. With insulin resistance, you become a type 2 diabetic. Do y'all have any questions so far?
No.
Okay. So a diabetic diet that is used nationally, just like what you said, is typically a low carb, low sugar, aka a low glucose or a low glycemic diet. It's also important to note, this is just a side note, that when you consume like protein and fat with a high carbohydrate food, it can actually help keep your blood sugar stabilized. We'll go over that more in detail in a second. In this presentation, we are going to cover some low carb and low glucose foods. Can anyone give an example of a low glucose food?
Ham, meats,
Cheese,
It's good. What about a high glucose food?
donuts,
carbohydrates.
cereal.
Right. So when you're hungry, what snack do you typically reach for in the kitchen? If you're hungry and want a snack, what do you typically
Chips.
grab?
Crackers.
Cheese.
Okay, well, the pamphlet that I gave you that compares low glucose or low glycemic versus high glycemic foods, that might be nice to either put or tape it to your fridge or your pantry, or you can take a picture of it with your phone, so then you can look back to that, and when you think, oh, I'm hungry, I want a snack, you can look back to your handout and maybe find something that's better for you and a healthier choice. When you have diabetes but do not watch what you're eating, this can make you more susceptible to diseases. This can affect your vessels, leading you to a decline in your cardiovascular health, such as stroke or a heart attack. You could even lose your eyesight eventually. You could develop sores that do not heal and even lose feelings in your feet or lower legs. Some diabetic friendly snacks include cheese sticks, low sugar beef jerky, slices of turkey, plain yogurt, cottage cheese, low glycemic berries such as raspberries or strawberries, nuts like walnuts and almonds, and vegetables such as like celery or mini carrots. Apples and peanut butter would be a good snack choice because that fat and that protein help that glucose from the apple stays stable in your blood. So it doesn't have that glucose spike even though you are eating an apple, which typically does have a lot of sugar in it. Some snacks that I would not consider diabetic friendly are crackers, bread, candy, cookies, chips, potatoes, condiments such as ketchup, barbecue sauce, or jelly, dates, and donuts. Does anyone have any questions about why these are considered poor nutrition choices for those who have type 2 diabetes?
Oh.
When you eat a low glycemic diet, this will help you maintain proper blood glucose levels and therefore not make your diabetes worse. So, to take away, this presentation was to provide you with knowledge about how diet can influence type 2 diabetes and proper nutrition choices to make in order to stabilize your blood sugar levels. Thank you for your time, and do y'all have any further questions?
No.
Awesome. All right. Well, thank you very much.
Thank you.
Thank you.
Now that we